So today we're going to talk about the Pterygopalatine Fossa and important structures that it contains. So to begin with, we're going to need to identify a couple of foramina in the sphenoid bone and a couple structures in the sphenoid bone. So basically, this cone shape right here is the place of the Pterygopalatine Fossa. So it's between the pterygoid plate of the sphenoid bone and the palatine bone anteriorly. So there are a couple foramina that will allow the passage of the structures that the Pterygopalatine Fossa contains. So the Pterygopalatine Fossa contains the Vidian artery, the maxillary artery, maxillary nerve, and the Pterygopalatine ganglion. So first, we're gonna see how the Vidian nerve, Vidian artery, which is a branch of the internal carotid artery that emerges from its petrous segment, which is C2. It enters the Pterygopalatine fossa through this Vidian canal. Okay, so the Vidian canal is an antero-posterior canal, so it pierces the sphenoid bone posterior anteriorly, or from posterior to anterior, right? And so if we want to visualize the carotid artery, it passes through here, through the petrous bone, and then gives off the Vidian artery, which enters here in the Vidian canal, and then goes upward and passes by the foramen lacerum, and then goes up into the cavernous sinus. So it moves upward and anteriorly, and then posteriorly, and loops here around the anterior clinoid process, right? So it gives off the branch right here, and the branch enters here, the Vidian, through the Vidian canal, and moves anteriorly till it reaches the Pterygopalatine fossa. Okay, the second structure that's in the Pterygopalatine fossa is the maxillary artery, which is a branch of the external carotid artery, right? And it enters here through the pterygopalatine or pterygomaxillary fissure. In a bit, we'll visualize the palatine bone, and the fissure will be clear. So this is the maxillary artery. The maxillary nerve enters the fossa through this foramen rotundum. So the foramen rotundum also is an antero-posterior foramen. It has an anterior and a posterior and anterior opening, right? And the maxillary nerve will enter the fossa through the foramen rotundum. And then this is a foramen. The sphenopalatine foramen is a foramen that is formed between the sphenoid bone and the palatine bone. It's going to be more clear when we visualize the palatine bone. It opens into the nasal cavity, right? So these are some of the foramina that will open in this fossa, and it will help us memorize the structures that this fossa withholds. So here we have the sphenoid bone right here, and this is the palatine bone, and this is the maxillary bone. So here is the pterygomaxillary fissure, and this is the fissure where the maxillary artery enters the fossa. Here also the fossa withholds the pterygopalatine ganglion, and Here is the maxillary nerve. Enters the fossa through the foramen rotundum, right? And here we can see the Vidian artery would travel through this Vidian canal into the fossa as well. Now we can fade the palatine bone so we can see more. So this foramen right here, that is formed partly from the palatine bone and partly from the sphenoid bone, the sphenopalatine fossa, and it opens interiorly into the nasal cavity, right? So this is the fossa right behind. It's a cone-shaped fossa, or a upside-down pyramid, right? That's right behind the palatine bone, as we can see here.